Rachel Green is a 30-something working mother of two. When she and her husband Bobby first started talking about having a family, each had a slightly different idea of the perfect family size.
Having lots of people around was always appealing to me, and I never thought of myself as someone who would only have one child or even two children. But I think Rachel may have been at one point at the two children stage.
Well, I have one sibling, an older brother, so to me, a normal family, an average family, my family should have two children.
Once the Greens decided to have a third child, Rachel talked to her OB-GYN, Mark Kaufman, who practices at Jupiter Medical Center in Jupiter, Florida. After a woman has her first child, Dr. Kaufman says she should consider timing before becoming pregnant again.
We kind of tell women to try not to get pregnant right away by any means, and we generally like 6 months. 3 months or under, we see a higher incidence of potential horrible complications such as stillbirth, neonatal problems, growth restriction of these babies, and preterm labor.
Experts advise that it's best to wait 18 to 23 months before getting pregnant again. Babies conceived less than 6 months or more than 10 years after a sibling appear to have a higher risk of premature birth, low birth weight, or small size for their gestational age. Rachel gave birth to their oldest daughter, Tali, 5 years ago. They had another child, Jacob, 2 years later, but they wanted to wait a little longer for baby number 3.
You know, we had Tali and Jacob only 2 years apart, and I think that both mentally and physically, neither Rachel nor I could have handled having a third that quickly.
That Jacob did. Come here,
Doctors say planning a birth and actually being able to conceive on time may present a challenge.
The first time, and with Jacob also, we got pregnant right away, and I assumed that this time it would happen that first month or two also, but it didn't, and I was surprised. It did take a little bit longer than I thought.
As soon as Rachel started trying to get pregnant for the third time, she began preparing by taking prenatal vitamins.
She needs to be having the right balance of iron in her system to make sure that there's going to be enough good, healthy blood flow to the baby. She needs to have certain vitamins and nutrients on board, such as folic acid, which is vital to the development of a healthy newborn.
Whether it's hard work, luck, or both, Rachel has remained the picture of good health throughout her pregnancy. She's kept up her exercise regimen and has stayed well within her recommended weight. But just because this is Rachel's third child doesn't mean there are no anxious feelings.
I haven't gone into labor in the traditional way. Either of my last 2 pregnancies, I was induced both times. So I still have that anxiousness that first-time moms have of, when is it going to happen? Will I feel the contractions? Will I be, in the grocery store and my water's going to break? So I still have that bit of anxiety hanging over me.
You know, we've had 2 induced labors, and I'm jealous of, my brother who calls me at 3 in the morning when they had their baby saying, the water just broke, we're on our way to the hospital. I want some of that excitement in my life.
One thing that is exciting for the entire family is that they already know whether the new baby is a boy or a girl.
Before we knew the sex, Tali kept saying how she would be so helpful, take care of the baby, help change the diapers, help give it a bath as long as it was a girl.
So during an ultrasound, Rachel and Bobby got 2 exciting bits of information. The baby is healthy and...
It's a little princess.
Having the older siblings involved in helping with the new baby gives them a sense of maturity and responsibility. It's another plus that comes with spacing the children a few years apart.
We try to include them in a lot of the decision-making, throwing names by them for their approval, asking them things about the nursery that, so that they feel that they're a part of the whole decision-making process.
I look at Jacob and remember thinking, when it was just Tolly, you know, how could you love anyone as much as Tolly? And, you know, now I'm thinking, how can we love anyone as much as we love Tolly and Jacob? But, you know, you will. And it's nice to imagine something that important that's not here yet coming into your life.
You're pacing the walls, the halls in labor.
But today, the imagining is over. The Greens arrived at 7 a.m. for induction. They waited patiently and walked the halls. The baby wasn't coming on her own, so doctors helped the process along by breaking Rachel's water. Around 4:30 in the afternoon, the contractions were frequent, and their baby girl was ready to be born.
She's coming. Oh, here she comes, baby. Push, honey.
Again.
Come on. Here she comes, Ray.
Okay.
Just before 5 o'clock,
Push again now.
Push, honey.
Nice and easy. Nice and easy. Look.
little Maya Gabrielle was born.
Get all this stuff out of you.
And she's definitely a hit with her older sister and brother.
And Jacob now says that he wants a boy baby after the girl baby. So I think we're done. But you'd have to ask Rachel that. I'd keep on going, but you know, I have the easy job.
Right now, I'm not thinking about a fourth. But you never know.